Health insurance is going to pay for your medication. It'll be between $5 and sometimes $60 a month. If you're looking at cash pay, you can go anywhere from $40 a month up to $1,000 a month. With such large variability in Suboxone costs, let's focus on some of the factors and some of the main three factors about pricing. Are you paying for it with cash or are you going to use insurance? Are you going to use a discount program? There are great programs out there that we'll discuss a little bit later. And then what formulation of Suboxone are you actually on? What does this mean? This includes your dosage. How many doses per day are you taking? And then how many milligrams of that medication are you taking per day? And this also includes if you're taking Suboxone brand name or the generic name. Generic always usually will be cheaper because brand name always is going to be a lot more expensive because you're buying it straight from the manufacturer. So now, as mentioned earlier, there's a lot of variabilities. A lot of these things will impact the cost of Suboxone, but will hopefully help you better understand why. Medication assisted treatment, or MAT, is normally the standard of care for opiate use disorder. And buprenorphine, which is the active ingredient in Suboxone, this is recognized as the gold standard for treatment of opiate use disorder. So the chances are, if you have insurance, your Suboxone is actually going to be covered. Most of my patients can normally pay between $5 and $60 a month for their Suboxone using their insurance plan. But why is there so much variability to the cost of Suboxone? Well, because insurance is complicated, as we all know. It's so complicated, actually. We providers, we try not to speak on it. We don't understand a lot of the nuances of insurance, but we know the basics. And like I said earlier, even with insurance, your prices are going to vary greatly depending on the type of insurance that you actually have. So one of the things that is consistent with insurance is when it comes to prescription formulary, every health insurance plan normally has one. The formulary is normally where you go to find out how much the cost of your Suboxone is going to be. So most formularies, they tell you a few different things. Which medications are actually covered, and that can be brand versus generic, the quantity or the amount of medication that you're allowed per month, and also the dosage per month that you're allowed, and then what the actual final cost of medication will be. And that means with your copay, did you meet your deductible? Every plan is different. The easiest thing for you to do is find out what your copay is from your insurance company, speak with the provider, and see how we can help adjust the cost if it is going to be something that's hard for you to afford at this time. If you're a bicycle health patient, we have a team of people that actually can help you do that. So please let us know. If you're paying with cash, a lot of times you can look at paying between $40 a month and up to $1,000 a month. The variabilities in pricing, they're also driven by factors like what state you actually live in, what formulation, as we spoke about earlier, of Suboxone that you're actually taking, and then what programs that you might qualify for a discount. Since you really can't control the state that you live in, most of the times there's limited control of what the provider actually is allowed to prescribe by the state. So here's some things that we can help with to help you with that cost. First, when it comes to the formulation of the drug, buying generic is normally going to be a less cost for most patients because brand name typically is always a little bit more expensive. Now, secondly, cash patients, we do have discount programs out there. These have you've heard of GoodRx, OptumRx, and there's another one by Albertsons called Single Care. All of these offer a little bit of a discount to Suboxone or to buprenorphine naloxone. Now, the brand name of Suboxone, they do have a manufacturer discount. Only problem is it doesn't apply in California and other certain states. So make sure you check the fine print at the very bottom of that discount card. And then on the Suboxone website itself at Suboxone.com, they have a program called In Support, which can a lot of times offer co-pays as low as $5 a month for your medication. And they usually qualify you based on your income and the situation that you're in. So the best thing to do is always reach out to them to find out if you do qualify. As with most things, the more product you need, typically, the cost is going to be higher. There's no one price fits all category for medications. It's usually based on the amount of medication you take monthly, the frequency at which you have to take the medication. These all will impact the cost. Now, there's basically a formulation of your drugs that comes from your insurance company. That can be based on the number of doses taken daily. That always will impact the cost because it impacts the quantity of medication you're getting every month. In addition, the second factor is the amount of medication you use. So when we talk about Suboxone, we're actually referring to buprenorphine, which is your 2 milligram, 4 milligrams, 8 milligrams, and 12 milligrams that you'll see actually on the medication box. So the larger doses, they oftentimes are going to cost more, and the smaller doses, they oftentimes can cost less. Usually, this is going to be determined by your provider based on your complete history, your exam, your history of use, and then just a better understanding of what's best for you in this season. Now, another factor to keep in mind is, are you taking tablets or are you taking films? The cost sometimes can be similar, but sometimes it's about a 20% difference in cost. Normally, films cost more than tablets, but that is not always the case. Now, lastly, and maybe the biggest factor of everything, Suboxone brand name versus Suboxone generic is going to impact the cost greatly. What do I mean by that? So 2019, Suboxone strips actually were finally allowed to go generic. The FDA lifted it up, and now we have buprenorphine slash naloxone, which is your generic formulation. That drove the cost down. Prior to that, Indivior in the UK, they had a patent actually on Suboxone strips. No one could produce anything. No one could bring anything like it. And usually most patents last for 25 years. So 2019 rolls around, a company called Dr. Reddy starts to make a new formulation of the generic brand, which then allows the cost to come down, which then allows higher access to patient care. And so we can actually get patients the medication that they need for opiate use disorder. So other brands you can think of are Alvogen, Mylan, and Sandoz. These usually don't matter when we're talking to our providers and to our patients. But if you start to have an interaction that you're not sure of and you don't know, maybe you're allergic to that actual manufacturer, we have seen that before. So the best thing to do is reach out to your provider, let's contact the manufacturer to make sure there's nothing in there that you could be allergic to.